Hello, I'm Dr. Gilbert. I work alongside doctors and sexologists, and welcome to this channel and a space dedicated to men's sexual health. Before we start, make sure to subscribe and turn on notifications so you don't miss our upcoming videos. Soft music masturbation is one of the most natural and widespread sexual behaviors in the world. It exists not only in humans, but also across many animal species. Yet, despite how common it is, masturbation remains one of the biggest taboos in our societies. Some people say it's good, others say it's bad, some say it's moral, others say it's dangerous. But where does all of this come from? A short history of masturbation. Historically, views on masturbation have changed drastically. During the Middle Ages, it wasn't particularly taboo. It was often mocked but not feared. Then came the 18th and 19th centuries. Under strong religious and medical influence, masturbation suddenly became seen as harmful, even pathological. At one point, it was classified as a mental illness. Yes, you heard that right. Young boys were monitored while sleeping. Some medical procedures were even proposed to prevent masturbation. Thankfully, those times are long gone. Today, after sexual liberation, the question has returned: is masturbation good or bad for men's health? In this video, I'll explain why men masturbate, what science really says, the real effects on health, and finally, does masturbation make you deaf? When does masturbation start? People often believe masturbation begins during adolescence, when testosterone levels rise. That's true, but not entirely. Scientific studies show that children as young as 4 or 5 years old may experience pleasure sensations and even erections. Before puberty, however, there are no sexual hormones involved. So what does that mean? A child is not engaging in sexuality as adults understand it. It's purely physical sensation, not social or sexual meaning. At that age, there is no sexual intention, no awareness of sexuality, only a pleasant bodily sensation. The only rule is simple: teach that it's something private, not something done in public. Does masturbation stop with age? There is no age limit for masturbation. Sexuality does not end with age, medically or neurologically. Many men believe their sexuality is over, only to rediscover it years later. Sexual desire can go through phases, and that's completely normal. Why does the body push us towards sex? Like all animals, humans are biologically programmed for reproduction. Sexual behavior activates brain chemicals like dopamine, oxytocin, endorphins. These create the reward system, the same system involved when we eat something we love or enjoy an activity. Masturbation plays a role in discovering sexuality, learning sensations, preparing the body for sexual interaction. Why do men masturbate? Our main reasons. 1. Stress relief. Orgasm releases hormones that reduce anxiety and tension. For many men, masturbation acts as a natural anti-stress mechanism. 2. Sleep aid. Many men masturbate to help them fall asleep. The relaxation after orgasm makes sleep easier. Some even rely on it too much, which we'll discuss later. Boredom. When time feels long and empty, masturbation becomes an easy source of pleasure and distraction. 4. Sexual frustration. This can happen when single or in a relationship with mismatched sexual rhythms. Important: masturbation in a couple does not automatically mean dissatisfaction. 5. Ejaculation control. Masturbation allows men to learn muscle control, delay ejaculation, understand arousal levels. It can improve sexual performance. 6. Exploring new sensations. Men often discover different pressures, different rhythms, sensitive zones. This self-knowledge can improve partnered sex. Does masturbation cause health problems? Let's clear the myths. Urinary or genital diseases. No scientific link. Infertility? No. Masturbation does not reduce fertility. The only logical exception: ejaculating repeatedly in a short time reduces sperm volume temporarily. That's common sense, not pathology. Cancer? Quite the opposite. Large-scale studies show that regular ejaculation, through sex or masturbation, is associated with a lower risk of prostate cancer. What about psychological effects? Masturbation itself does not cause psychological disorders. However, if someone already suffers from anxiety, stress, emotional distress, masturbation may become a coping mechanism. Overuse is not the problem. The underlying emotional issue is. This can create a false belief that masturbation is the cause, when it's actually a symptom. Does masturbation make you deaf? This myth comes from an old 18th century medical book. A doctor noticed slight ear sensations during orgasm, due to relaxation and blood flow changes. He mistakenly concluded it damaged hearing. The truth? No, masturbation does not make you deaf.